Good, very early morning to everyone joining us from Africa. Good morning for people joining us closer to our time zone here in Bangkok. And good afternoon or good evening to everyone joining us from everywhere else in the world. We have a few more people connecting, but I say that we should get started now since we got a pretty packed agenda today. I'd like to thank you all for joining this Asia Pacific Stats Café session that we are hosting in collaboration with ECA, the Economic Commission for Africa. I know the timing is not ideal for all time zones, so it's really great to see people joining us from the African early hours. My name is Nicolas Patouanamel, and I work with the ESCAP CRVS team, and I'll be moderating the session for today. So as you all probably already know, this session is about a program that ESCAP and ECA have been running since April 2024, the CRVS Applied Research Training, otherwise known as the CART. And so the plan for the session today is quite simple. I'll start by giving a brief overview of the training, and then we're very lucky to have some of our alumni of the training to join us and talk about their research projects and their experiences as participants of the training. And then we will have some time allocated for Q&A after all the presentations. So if you have any questions about the program or about any of the participants' presentation, I'll invite you to maybe note them down in the chat or maybe ask them after everyone has presented, or write them down in the chat so we can answer them throughout the session. So I'll start by briefly introducing what exactly is the CRVS Applied Research Training. So for those who may not be familiar with the acronym CRVS, it stands for Civil Registration and Vital Statistics. Essentially, CRVS systems are the official mechanisms through which governments record key life events such as births, deaths, marriages, divorce, etc. And these systems are really important because they make it possible for governments to establish legal identity and protect individual rights. So for example, if a birth goes by unregistered, a child may face some significant challenges in their life when accessing education, healthcare, or other essential services. And also in CRVS, there's vital statistics, and vital statistics are generated through CRVS systems and are very essential and provide essential data for that government researchers, development partners can use them in order to plan services, track population trends, and design effective policies. So like things like data on fertility, cause of death, and life expectancy are all important and ideally all come directly from CRVS systems. And I say ideally because in many countries across Africa, Asia, and the Pacific, a significant number of births and deaths go by unregistered. And that means that there's some critical gaps in government data on who is being born and who is dying. And also deprives a lot of children of legal identity. Not only that, but data coming from CRVS system is really important for planning and implementing SDGs, a lot of them related to health, but also for social inclusion, education, good governance. It's a source of, in total, more than 72 indicators, many of them being beyond health, like ending child and forced marriage. And there are specific SDG indicators for CRVS systems, notably target 16.9 about providing legal identity for all, as well as other targets under SDG 17. And so both of ECA and ESCAP have been working with countries in order to strengthen their CRVS systems. And the thing is, there's a growing interest in CRVS research, but ultimately not a whole lot of evidence out there on this topic. It's still quite a niche topic, and what that means is that the evidence that we really need to improve CRVS system can often be lacking. There just aren't that many publicly high-quality available studies that create and that creates a big gap when it comes to implementing solutions to reinforce these systems. And so in 2023, ESCAP hosted the first CRVS Research Forum, which was hosted online. The goal was to offer research, information sharing, capacity building, and networking opportunities for people working on CRVS research. And the thing is that we identified that there was a shortage of research capacity and interest in the field of CRVS. So that's when we started thinking about a way to generate more interest and capacities for practitioners to research the CRVS systems that they're working on. And so that's how we came up with the cart. And by the way, we have another CRVS research forum planned for 2026. So if you're interested, you can go on our website to learn more about it, and we'll share some links towards the end of the presentation. So now let's talk about the CART, the CRVS Applied Research Training. So as I mentioned, the role of the CART is to facilitate the improvement of CRVS systems through applied research and evidence-based interventions. And we aim to do this by strengthening CRVS professionals' research capacity and to equip them with the necessary skills and give them the necessary support for them to produce high-quality research. Essentially, we want to build interest in the topic and develop a network of trained researchers in order to increase research capacity on CRVS-related topics. And so this is a joint initiative between ESCAP and ECA, where we get to exchange about our research, our experiences, and share our lessons across both African, Asian, and the Pacific region. And it's really about creating a space where we get to learn from one another, build connections, and also learn from each other's experiences. And so the one-year training program, the CART is a one-year training program, and we've had 2 cohorts so far, one in 2024 and the other one that started earlier this year and is still in progress. Together, we have a total of 90 participants from 36 countries that we're supporting. And these participants are all practitioners and come from a wide range of professional backgrounds. So people working in national statistical offices, health authorities, registration authorities, and even civil society organizations. And the training itself is topic agnostic. We don't really focus on teaching hard skills. Instead, what we do is we try to guide participants in designing and carrying out their own project. And the idea is that everyone brings their own expertise, background, professional networks, but then applies it in a way that helps them in researching and strengthening their own CRVS systems. And so in order to be eligible for this initiative, you must be employed, but also the project that you're proposing must be related to CRVS systems or make use of CRVS data. And then we'll get a chance to hear about some of the examples of the projects that have been done as part of this initiative from our alumni later on. So how do we do this exactly with the CART? So first off, the CART offers support in a lot of different ways. And the first one is with some of the resources that we have hosted on CIAP, the Statistical Institute for Asia and Pacific. So we have our e-learning platform there, which offers like the opportunity for people to watch some educational content on research, but also offers current CART participants a way to exchange and share information through forums, as well as sharing links through a bunch of different resources. Throughout the year-long training, we also ask to see progress on the participants' projects and provide some continuous feedback on the projects that it develops. So each participant gets the opportunity to interact with an ESCAP or EC resource person. And every 2 months, we ask to see a deliverable which supports the research process. So things like doing a literature review, developing a proposal, developing a data analysis, and all these things culminate into first draft research paper. And throughout that process, we'll provide some in-depth feedback through all of these deliverables. And then after 1 year, even after the training is done, we continue to support the participants as they go through the dissemination process. So we do things like supporting them in writing up the paper, submitting to journals, or publishing a policy brief. So to support participants in their project, we make use of our network of CRVS experts and researchers. So this includes people working in ECA and ESCAP, but also our CART alumni and colleagues from other organizations. And so we try to match participants with the best resource person based on their research topic and projects. And then we also have 2 in-person workshops as part of the year-long training. One towards the midpoint and one at the end. And what we do is we bring together all participants from Africa and Asia and the Pacific. And then we bring them all together for 1 week where we have a lot of sessions and intensive group work. and also provide the opportunities to have discussions about research topic, but also an opportunity to present your topic or participants present their topic to their peers, and also get to critique the work of other that have been involved in this initiative. And as I mentioned, even after the participants are done with the year-long training, they are still very much involved in the initiative. We only have had one cohort that has completed the training so far, but we are still very much involved in our research or involved with them in our research activities. Some of them have also been working together on joint projects. Many of them are going to be attending the CRVS Research Forum happening in early 2026, as I mentioned a bit earlier. And some will also be mentoring participants for future cohorts. So even after the training is done, alumni are still very much part of this initiative and can continue to get involved in this growing community of CRVS researchers. So that's all from me right now. I know I've been very brief about a lot of details, but I think hearing from alumni will give you a better idea about the type of support that this initiative can provide. So again, please write down all of your questions in the chat and we'll try to address them throughout the session or at the end of the session. So enough of me talking. I think we all want to hear from our alumni. So these alumni have been part of our first cohort, so our 2024 cohort, and we'll get to learn more about the project and their experiences as participants. And so let's start in Sri Lanka with one of our participants or one of our current alumni, Gabishika. So Gabishika, she's currently working as the director of the Medical Statistics Unit of Ministry of Health in Sri Lanka, where she's responsible for morbidity and mortality statistics. She's also responsible for conducting demographic and health surveys in Sri Lanka. So Gabishika, thank you very much for joining us today, and over to you.
Thank you, Nicholas. Good morning, good afternoon to the CRVS team at the ESCAP and ACA and the fellow CART participants and the distinguished guests. I'm really happy to join with you today to share my experience. Nicholas, you can
yes,
move
I'll
my
move the slides.
presentation.
I'll move the slides. Just tell me.
Right. Thank you. Thank you for the warm introduction, and I'm deeply grateful for Nicholas and the CRVS team for me giving this opportunity, actually. As the director of the Medical Statistics Unit at the Ministry of Health Sri Lanka, I am a frequent data user of the CRVS. I rely on timely and accurate mortality data to support the public health programs. However, when the data is delayed or incomplete, it creates challenges for us. That's why I joined the CART to explore alternative methods that could strengthen our CRVS system. Today, I will briefly introduce my research topic, counting household deaths, a novel approach to measuring mortality using routine household surveys. So we'll see how I work with the CART cohort 1. You all know that accurate mortality data is essential for the policy planning, monitoring disease control programs, and the fund allocation. And the CRVS system is the best data source to provide vital statistics. But it should be with the full coverage and the high completeness. In many countries, including Sri Lanka, registered deaths are used as the total count of deaths because there's no information about the unregistered deaths. This gap, the registered and the unregistered gap, affects the reliability of the mortality data. Move on, please. Now we'll see the Sri Lankan CRVS system. Sri Lanka has a long-standing, well-established CRVS system. And in our country, legally, all deaths should be registered. Annually, approximately 170,000 deaths are registered. But our CRVS system is a paper-based one. Like most of the other countries, we are still paper-based. Discussions are on the way to digitalization, but still, our system is paper-based. So due to the administrative delays, Registrar General's department could not publish timely data which we need for the health, public health programs. That is, for example, actually, mortality indicators are available for 2020. Please move. This is the place actually I found my gap. There's no alternative data source exists to support CRVS system. Surveys like DHS and the MIX and that type of surveys, they are very expensive. And on the other hand, they are focusing on specific age groups like children or the maternal deaths. In this rapidly aging era, home deaths are increasing. But we lack mechanism to verify that whether our all deaths are registered. The paper-based system cannot, the paper-based CRVS system cannot produce timely data. That is why I wanted to explore an alternative method. Please move. Right, please move. Right, these are my objectives and the methodology. My objective is like exploring an alternative method to provide CRVS data needs and find out gaps in the CRVS system. Earlier, actually, I was rely on. I was working on the completeness, but later I changed my path. My methodology is like first. Actually, I conducted literature survey to find out the alternative data collection methods which are using in the other countries. And then I studied the routine household surveys conducted by the National Statistical Office. Since I am a person coming from the National Statistics Office, I know that the procedure of doing a household survey. So I found there is an opportunity available with the census block updating stage because I do not want to conduct a separate survey for the mortality to collect mortality data. I found because I want to introduce something less cost method to collect mortality data. So then I saw the listing updating stage I can use to collect mortality statistics. Please move. In Sri Lanka, 2,500 census blocks are selected annually for the labor force survey. On average, a census block has 100 households. Right? That means our enumerators, our field enumerators visit around 250,000 households per year. I thought this is a golden opportunity to introduce a mortality questionnaire. So I introduced a small mortality module to collect household death data during the listing stage of the labor force survey 2024. Actually, I did a pilot study selecting a limited number of census blocks. So now see the my steps I followed in the next slide. So this is the pathway of my research, actually, the way that I have collected data. First, I study the questions included in the household surveys like DHS and the MIX and some other surveys. And then I developed a simple mortality questionnaire. And then that questionnaire was I pre-tested in a census block update in one area. So then I realized that this method I can apply. So then I requested 20 census blocks from the labor force sample. So then I introduced I selected that census blocks and I introduced my mortality module to that block. Actually, I did a pen and paper method. I had no time to put it into a CAPI version. So I trained my enumerators and the supervisor signed into that census blocks. And I introduced the questionnaire. During the field work, I supervised and monitored the data collection. And finally, end of the data collection, I had a focus group meeting with the enumerators and the supervisor to see the feasibility of the study. And then I got the data and I cleaned and entered into Excel sheet, and using SPSS, I analyzed data and draft my paper. Please move. During my pilot study, I found 88 deaths from 1,515 households. So for that deaths, I found demographic information related to the deaths, and then all the deaths I found were registered in the system, and enumerators also accepted the method. They requested a CAPI method. That is because that is easy for them. In Sri Lanka, the labor force listing updating was done by using a CAPI method. And they said that the respondent also respond well for the mortality questions. Earlier, I used the reference period for 2 years, but the enumerators, they, according to them, actually, their feedback, they asked me to reduce the reference period for deaths for 1 year. That is more, then we can get the more reliable data. So now my data collection method is I have finalized, and now my goal is to write down all the things in my research paper. Right, please move. These are the 2 missions actually I have. Apply this method and provide data wanted for the public health programs one day, and publish my work in a paper, research paper. So as a card participant, actually I want to tell you the journey, my 1 year journey. Last year actually, what I have done. The research is a learning process. Research is a truly learning process. It's not a kind of a linear one. Because we had some difficulties like challenges. We wanted that extra knowledge. So that is why actually I'm saying the research is never a linear process. It's a journey actually, filled with curiosity, challenges, and a lot of ideas. At the very first, I started with the gap, and then I explored literature, try to find out answers for my questions using the literature, and then I forward. You should have an interest first. So when we have an interest, we can find the knowledge and the assistance from our environment, right? Then we are keep on moving until we find the final goal. During my difficult times, actually, my supervisors, the Nicola and the Nicholas, they helped me a lot. Like my mentor, they helped me. So please move. Reflection as a card participant. Actually, being part of the card was an exciting and transformative experience for me. It was filled with goals, commitments, and the achievements. We had rich discussions from professors from all over the world, like best CRVS practitioners. We learned a lot from our colleagues. So because we met a very rich community from the ECA and the ESCAP, they are actually future leaders of the CRVS. I feel like they are the future leaders of the CRVS system. And we met donors, and we met very good lecturers from the reputed universities. So please move. The CRVS network, actually, we were like still together, actually. This network gives us many opportunities. We continue with our work, and actually in Sri Lanka also we participated of 4 participants. We were frequently now we meet each other and we help each other. Actually, we remain connected with all the other participants, and I look forward to continue further to the global community. Thank you very much, Nicholas. Thank you very much.
Thank you very much, Gavishika. Thanks for sharing your insights, and I'm very glad to see that your project is evolving well. I think your project reflects very well how researching and documenting something like a survey methodology and trying to integrate measuring completeness of debt registration can really serve as a foundation to like scaling up to a national intervention. So yeah, thank you very much for your presentation, Gavishika.
Thank you. Thank you very much.
Yeah. And so after Sri Lanka, I think we'll go to the African continent, where we'll hear from one of our African alumni, Stephen Kasumba. So Stephen is a manager for the monitoring and evaluation of the National Identification and Registration Authority in Uganda. So thank you very much for joining us today, Stephen. I'll now hand it over to you.
Thank you so much, Nicholas.
We don't see you. We don't have your camera on. Okay, now we see you now. Perfect. Thank you. Please go ahead.
Yeah. Thank you so much, Nicholas. Thank you for this wonderful chance to participate in this presentation. Distinguished participants, my colleagues, ladies and gentlemen, I am presenting a research project we did on the determinants and patterns of timeliness of birth registration in Uganda. And we are using administrative data from 2020 to 2024. As Nicholas has indicated, I am the manager monitoring and evaluation of the National Identification and Registration Authority. That is the agency responsible for civil registration in Uganda. Uganda is within East Africa, one of the landlocked countries in East Africa. Next. Maybe before I can go into the project, I was part of the first cohort, and the program combined e-learning resources, mentorship, and face-to-face workshop. We had one in Dubai, the other one was in Bangkok. What I can say, this kind of training significantly enhanced the quality and the impact of our research project, as you will see later. Next up. This study assessed the Uganda's birth registration system using over 769,000 records from NIRA. Of course, the records were more than 2,500,000, and we had to undergo the data cleaning process. And we concentrated on those records which finalized the process of registration. It examined the socio-economic, demographic, and structural determinants of timely rate and delayed registration. Next. Of course, the main objective was to investigate the determinants and patterns of late and delayed registration in Uganda. And we had specific objectives, which included, among others, to analyze the regional differences in the notification registration conversion time. Of course, we had issues of examining the relationship between notification, registration, conversion time. And we also investigate the regional variation in timeliness. In Uganda, you have about 6 regions. You have the central region, which actually where the most population concentrates. Then you have the eastern region, you have the northeastern, you have the western region, the midwestern, and the northwestern region. Those are 6 regions. As I go on, I'll be discussing in detail about those regions. And of course, the health system is managed through the health facility systems, as we are indicated later. And this part of research was actually assessing the influence of health facility levels on birth registration timelines in Uganda. Next. Of course, that is a conceptual framework. It had timelines as a dependent variables. And that timelines had about 3 levels. The first level was those children who are registered within the first 30 days. And then you have the late registration, those are between 30 to 60 days, as I will explain later. Then the delayed, those are over 1 year. And of course, the predictors, you have demographic predictors, temporal variables which are computed, and the geographic factors, region, birth districts. Then we have institutional factors. Those are the birth facility levels, as I was trying to indicate. Next. Of course, in current research, as I told you earlier, of course, we're using administrative records. These are the real records which were done by our registration officers in the field. What I can say, participants, that this kind of research was actually involving almost everyone in the National Identification and Registration Authority. And we used, the design was quantitative cross-section analysis. The data, then the sample size as I indicated later was around 769,472. And the dependent variables were timeliness, as I told you. We had to investigate the inefficiency within the registration system, the predictors, gender, the time to notification, registration delay, region, district, facility level, and the statistical method we used in a variate, bivariate, and multivariate, based on that. Next. The key findings, as I will indicate later, of course, only 7% of births registered were registered on time. That means 7% of births in Uganda were registered within the first 30 days. 25% late. That means 25% of births happening in our country are actually registered after 30 days, by the way, before the end of 365 days. That is within a year. They are late. Then, of course, 68% delayed. That shows a high level of inefficiency, especially from the demand side. So we carried out investigation on that, as I tell you, and what I'm presenting is actually the key findings. As I've already indicated, Central Region had the highest share of around 36%. The Northern Eastern and the Northwestern, the lowest. Then, of course, when it comes to institutional factors, the medical centers, people tend, because most of these medical centers are actually private, they tend to delay to register our children. Then, of course, when it comes to referral hospitals were more efficient because most of the systems are actually established. Then the hospitals recorded high delays, about 70%, despite the high birth volumes. The strong predictors, the strong explanations, the variable that explained this kind of inefficiency were time to notification. This one was computed. It was basically the time the child is born to the time the child is notified. We had all the birth dates for children registered into our system within our national civil registration system, and the day they were notified, then we computed that variable, then the conversion time from notification to registration, as I will indicate later, that one was actually okay. Then, of course, issues of maternal education and geography all constituted a high level in terms of explaining the inefficiency within the registration system. Then, of course, the median delay. When we came to the median delay, it indicated around 3 years. The children cannot interface with us. As of now, there is a lot of delay for a child, a newborn, to interface with our system for around 3 years and 2 months. It takes a child to be notified. That is a high level inefficiency. Then from notification to registration, just 3 days. There we are trying to cope up with the health system. Next.
Sorry, Stephen, can you go quickly over your findings? We're a bit short on time. Thank you.
Oh, yeah. Okay, that is what I've already been explaining. Next. Can go to the next one. Yeah, as indicated, you can see the regional variation in notification and registration delay. You can see in Central Region, we are really deviating away seriously from the concentration of delayed registration happens as compared to the other regions. And the Northeastern region also has issues. Next, sir. Yes, as I told you, when it comes to the predictors, the time to notification really plays a very big part. And the notification education, they really explain this kind of research and the facilities, as you can see. As you go lower, of course, they tend to minimize in terms of explaining the issues that cause delays in registration process in our country. Next. When it comes to the table, of course, this one is explained that we use the monomial logistics model to estimate the late, delayed, and the late, delayed registration. As you can see, using the odd ratios, of course, the strong predictors, of course, is time to notification, and the notification registration conversion time. As you can see, it is all above 50,000. Or the odd ratio in the column. Next, let me explain it in the next slide. Yeah, of course, time to notification each day drastically increases the odd ratio, 51,033. Then when it comes to notification registration conversion time, it is strong. It's also strong, has a strong impact on the late registration. Then, of course, the birth facility impact. Hospital births are more prone to late registration than clinics, health center 2 and 5 hospital. That is a key predictor of late registration. Next. In terms of policy recommendation, of course, there are a number of issues that are happening now. We want to integrate the birth registration into maternal and newborn child health services. That one is ongoing as I'm speaking. This evidence-based research managed to really open our minds. We are establishing mandatory immediate birth notification and waive related fees. The Minister of Internal Affairs has just issued a statutory instrument waiving some of the fees which were actually preventing early registration. It is free of charge for the first 6 months. Then, of course, we are also intensifying to expand the mobile digital platform to rural and those underserved districts. We are training and deploying more health workers and registration officers, and we are strengthening caregiver awareness campaigns focusing on women empowerment. We are also introducing real-time monitoring system for timeliness and the coverage tracking. Next. As I conclude, the project revealed major inefficiencies in Uganda birth registration system with severe delays and inequalities among regions. There is evidence has already been this evidence has already informed policy reform, donor engagement academically, academic visibility, and the operational improvements in the NERA and the CRVS system in Africa. My learning experience, of course, during this period, we shared a lot with the team members from Asia, from Africa, and we managed to really learn the advanced research skills. We were trained how to orient some of this operational research to policy. Then, of course, there was a lot of exchange. We benefited from mentorship across the countries, learning with peers and experts across Africa. Next. Contribution, of course, this paper was peer-reviewed in Discover Health System, and it was published. If I'm to talk about the peer review process, it was a long process. And I thank all people who really came in, and we made before that this paper is published. We contributed evidence to NERA and CRVS policy discussion, which is ongoing because we are really doing badly in this area. And of course, as I'm speaking, we have also engaged the health workers and registration officers to ensure that we meet the requirements. Next. Personal reflection, of course, I can confidently say that during this period of 1 year, I sharpened my statistical and analytical rigor while enriching my role as a manager in NERA. It defined the importance of evidence-based policy making in strengthening CRVS systems and ensuring universal legal identity in Uganda. Then finally, next slide. Finally, acknowledgement, of course. I acknowledge our ENECA, then the ESCAP for doing a wonderful job during this time. Sponsorship, we acknowledge the Data for Health Initiative. Then the mentors who are actually part of this system, Mr. William, Dr. Aaron, Ms. Lillian. They were part of the whole system because we did this together and of course with other colleagues. Then those who are interested in knowing or not getting the details, you can go to that link. The article is published. Thank you.
Thank you so much, Stephen, and congratulations on getting your paper published. It's really great news. And next, from China, more precisely in Shanghai, where we have a few CART alumni and current CART participants. We have we've been involved with the Shanghai Center of Disease and Control, and today we have Li Qi joining us. So Li Qi works for the Shanghai Center of Disease and Control and is responsible for debt registration, cause of debt surveillance, and data quality control for the city of Shanghai. So thank you very much for joining us this morning, Li Qi, and over to you.
Thank you, Nicholas. Hello, everyone. I'm Li Qi. Big thanks to the CART support team and Nicholas for letting me share my research and my experience during CART Cohort 1. I might be one of the luckier ones as I successfully published a paper during 1 year CART period. Today, I will speak in 3 parts. Next, please. The overview of my research, the main outcomes, and my experience within CART. Next. Okay, my project examined the association between ambient temperature and cardiovascular disease mortality in Shanghai, China. As China's economic center, Shanghai has maintained the CRVS system since the 1950s, giving me access to a long, high-quality local CRVS stats data. The climate change is altering temperature worldwide, and its health impacts are strongly location-specific. Even at the same latitude, the climate, the economy, and the healthcare capacity differ. So evidence based on local data is crucial for local policy. Here I applied a DLNR model to analysis both the exposure response and lag effect dimensions. Daily counts of CVD deaths, average temperature, relative humidity, and PM 2.5 from 2015 to 2020 were collected. The flowchart on the right was developed under guidance of CART mentors. It maps the entire pathway from database construction to descriptive and modeling analysis, and finally to research dissemination, helping me clarify my research plan from the very beginning. Next. My research contains a full set of analyses. Here, I will highlight the key results that have already been published. First, the time series plot of daily CVD deaths and temperature shows a clear seasonal trend. The mortality peaks between the December and the March when temperatures are lowest. During the same winter season, the PM 2.5 levels are also maximized. So to adjust for this potential confounder, the PM 2.5 levels were included as a covariate in DLNR model. Next. The exposure response curve of temperature and the relative risk of CVD mortality shows an inverse J shape. The lower the temperature, the higher the risk of CVD death, and the risk is higher in males than in females. Next. Analysis of the lag effect shows that the impact of cold temperature on CVD mortality appears in the 2nd to the 3rd days after exposure and persists until the day 21st, while the impact of hot temperatures only occurs in the 1st to 2 days. Next. From this, we can draw the conclusion that although the global warming is a general trend of climate change, but in Shanghai, we still need to attach importance to the long-term lag risk of cold-related CVD mortality. So when formulating policies, such risk patterns and gender differences should be taken into account. Next. Although the CART lasted only 1 year, outcomes of my project were both significant and substantial. sustainable. Next, during the training period, I published a paper in Atmosphere. Now I'm continuing to write more papers and receiving continuous guidance from the CART expert team. In addition, influenced by the slogan, "Get everyone in the picture," I also organized the R code for data analysis and shared the codes. Next, shared the codes in Chiang Mai, Thailand, Jiangsu Province, and Shanghai, China. By using this code, researchers can obtain local epidemiological evidence using their own local data. As the CART experts commented on my research is results for Shanghai and methods for everyone. Next, my research also selected as poster presentation for high-level academic conferences in China hosted by the Chinese Medical Association and the Chinese Hypertension League. This has enhanced my academic reputation and given me more confidence and motivation in my research work. Next, as a participant in CART cohort 1, I think there are 4 important points. Next, first, the CART has helped me develop the academic thinking. Before CART, I only describe changes in CRVS data, wrote some simple report, but now I will think about what and why this matters for policy and how to benefit other regions. The importance of skills is also an important aspect that CART has brought to me, from data to collection to analysis, and finally to the writing of articles. There are courses and expert guidance available. Also, CART boosts my efficiency. I think it's very important. During the training, we submitted 5 deliverables, each with a firm deadline that forced progress outside my routine work. The rapid feedback from the support team constantly reminded me I can't postpone this. Finally, CART provides an excellent international platform with participants from various countries and opportunities for face-to-face communication. Here you can see the marking sheets of my first 3 rounds of deliverables. With the learning at CART, my research scores have significantly improved. I believe there is nothing more exciting than making progress. Next, as Dr. Petra said at the close of CART 1 in Sriracha, Thailand, it is a remarkable thing to see people of different nationalities and colors sit together to discuss how to turn CRVS into high-quality research and evidence. So welcome to CART. Thank you.
Thank you very much, Vici, for your great presentation. I think your projects reflect very much how data from CRVS, like data on cause of death, can be used to support research and develop public health interventions, just like you mentioned. So, really amazing presentation, and I'm glad to see that you're moving forward with some other papers based on your CART project. So, congratulations. And so last but not least, we have another alumni from Africa. So Liako from Lesotho. Liako is a civil registration officer with the National Identity and Civil Registry of Lesotho. Thank you so much for waking up early this morning and agreeing to present. So over to you, Liako.
Thank you very much, Nicholas, and greetings to you all. I'm very happy to be part of this forum. Thank you. I'm going to share, like Nicholas has just shared, my name is Diako Pel Mukwena, and I work for the Ministry of Local Government and Chieftainship, Home Affairs and Police under the Department of Home Affairs and under the section of National Identity and Civil Registry in Lesotho. I'm going to share with you the impact of my research titled Impact of Digitization on Birth Registration Completeness in Lesotho, a mixed method study. Next. The problem statement, there is lack of universal and timeous birth registration causing low completeness rates. and lack of clear notification systems due to weak stakeholders collaboration in Lesotho. And there's also limited technological infrastructure and inadequate human capital. The objective of my study was to study the impact of digitization systems in improving birth registration completeness. And you will remember that improving birth registration completeness is also one of the goals of the African Program for Accelerated Improvement of CRVS, and also to study challenges inherent with digitization of birth registration and successes. The background or context of this research is that the civil registration in Lesotho is mandatory in terms of the laws of Lesotho. However, this cannot be enforced because it is not universal and accessible to all. Due to the terrain of Lesotho, there are still barriers such as cost implications due to distance and lack of infrastructure in hard-to-reach areas. And some of the areas in Lesotho are identified as chopper sites. That means you have to fly there to serve the population that is staying there. So as an intervention to this, Lesotho introduced the digitization system in a form of automated CRVS system in 2013. And this CRVS system links birth registration with ID management system and generates the unique identifier from birth registration, that is the ID number. And COBO e-notification application was also introduced. It is installed in tablets and was piloted in 2022 and officially launched in 2023. Next. The literature gap. I saw the literature gap that most studies focus on infrastructure or access to CRVS system, while few studies assess actual completeness outcomes, stakeholders dynamics, or the role of legal frameworks in digital CRVS systems, especially in the context of Lesotho. The main research questions of this project was whether use of digitization systems in civil registration has improved birth registration completeness in Lesotho, and what challenges and successes has Lesotho experienced in implementing digitization of birth registration. And the challenges are in the light of human capital engaged in birth registration activities, stakeholders, collaboration and coordination, and the enabling legal framework. The significance of this study, the study offers a critical insights to help Lesotho strengthen her CRVS system and accelerate progress towards SDG 16.9. As you know, it calls for identity for all by the year 2030, including birth registration. So this will help by enhancing e-notification mechanisms for timely and accurate digital reporting, and modernizing legal frameworks to align with technological advances, and fostering coordinated stakeholder collaboration across government, health, and community sectors. Next. Nicholas? Okay, thank you. And the methodology. The study, this study, I took the mixed method design, which a quantitative approach comprised of analysis of birth registration data with pre and post digitization. Pre-digitization, I took the period of 2008 to 2012, and post-digitization, it was 2013 to 2022, which is 10 years. And birth registration data was gathered from vital statistics reports published by the Bureau of Statistics. And qualitative approach was, data was collected by use of purposive sampling technique, where interviews with registrars known as district managers and civil registration officers were conducted to explore challenges and successes of digitization in their respective districts and of course at the national level. And analysis combined statistical trends with grounded insights from the participants, showing the rationale behind the differentials in the birth registration numbers per year, highlighting the challenges and successes thereof. Thank you. Next. The key findings and implications of my study. The successes, there is increased birth registration numbers and completeness rate from 2.8% in 2008 to 66.1% in 2022. And there's also improved timeliness and efficiency and improved traceability and verification, because now most of the population is now in the National Identity Register. And the challenges involve limited coverage of digitization systems, and there are no provision of digitization in the legal framework. And there's also incompetence of civil registration assistance and lack of stakeholders' participation in digitization processes, also lack of stakeholders' cooperation and coordination structures. So as we come to the operational implications or recommendations, I suggested that we formalize stakeholders' working relationship in a form of maybe MOUs, especially the Ministry of Health, and also to establish stakeholders' coordination structures from high level, and also to roll out and intensify use of tablets for notification in all districts. That is the COBO application. And also employing civil registration assistants on permanent basis, then intensify their training. And for policy relevance, it is recommended that amendment of registration of births and deaths Act of 1973, or together with its regulations of 1974 should be done, and it should be treated as urgent, I think. Yeah, thank you. You can, next slide, please. CAD program and structure of my experience. A CAD program consisted of online learning, which involved self-paced model classes, which enabled participants to easily squeeze in their busy schedules. As you know that our participants, we have workloads, we have all those things. So the self-paced model classes enabled us to squeeze those in our busy schedules. The assignment had clear deadlines and feedbacks, and the clear deadlines enabled us also to prioritize daily activities with this, and the feedbacks paved the progress. There were 2 in-person workshops, and in Dubai, we had to present our proposals and then get feedback from our mentors. And it was very, very helpful to have access to all mentors present there, with ECA mentors and then ESCAP mentors. And one just has to choose who you want to discuss your topic with. And I remember my initial topic was registration of births and deaths using in Lesotho, challenges and successes. And after being introduced to all mentors around there, I chose to meet with Dr. Ellen, who is a lecturer in one of the African universities. And my reason for choosing to meet with her face to face was to discuss my proposal with her and then see where it stands, and through an academia point of view. And of course, after my presentation to her and the presentation to the whole house, involving with the participants and the mentors, my topic had to change, because they shared the same sentiment that my topic was too broad, because it involved the 2 vital events. And I think I was very, they made me realize that I was very ambitious at the time, and I underestimated the workload coming with the research that was just too broad. So they helped me a lot in making my research to have a sense of focus. Yes. In Thailand, we presented our first draft papers, and we had a peer review, and then our topics were refined. I remember my first draft paper was marked by 3 mentors from ECA, which greatly helped to refine it, but it was very abnormal. You can imagine receiving a feedback, and there are these track changes from 3 people. This one is saying this one is saying this, but it was very helpful, really, and well appreciated. My CAT personal impact, I developed a publishable paper on digitization and birth registration in Lesotho. I gained mentorship in operational research from international experts. I improved my research, writing, and presentation skills to inform policy. I also built a global network of CRVS professionals through the CAD program. Next, please. the outcome of my project. My project has initiated a policy influence, as my research has already informed a formal recommendation for legislative amendment, as I authored a policy brief titled Digitization, a Call for Amendment of Registration of Births and Deaths, Act of 1973. You can see that the act is very outdated, so we have to amend it as soon as we can to accommodate digitization. And also there is publication in progress. The full paper is complete and undergoing review towards publication, including the ECA CRVS peer review publication. And also evidence-based advocacy. This work preaches research and policy showing how academic inquiry can drive real change, real world change. Hence, CAT is offering an applied research. Yes. As I conclude, my final message is that if you are ready to grow, contribute, and publish, this is your moment. Remember, there is no school for CRVS, and CAT is offering us an opportunity to capacitate us in CRVS issues. So let's take this opportunity with both hands. I thank you.
Thank you so much, Liako, for this awesome presentation. And honestly, it's great to see how your project has evolved. And, congratulations on your policy brief that has been published, and best of luck with your ongoing journal publications.
Thank you so much.
Thank you. So really thanks to all our speakers for your amazing presentation. I think it really helped kind of set the scene, or at least give more information to any of the prospective applicants or prospective participants as to what exactly this program is about, how we support you, and the type of project that we aim to support as part of this initiative. So we have about 10 minutes left for questions. So if you have any questions for our presenters, either about any of their projects that they've done as part of this program, or either about their experience as CART participants or CART alumni, or even some more general information about the CART, like the application process, please write them down in the chat. There was one question that was answered a bit earlier, but it was a question from Dr. Hilda Harb from Lebanon. She was asking if if the presentations will be shared, and yes, they will be shared on the ESCAP webpage for this event. And the other questions was regarding if the training was open to other regions than ESCAP and ECA. And unfortunately, right now, this project, as of now, is only open to ESCAP member states and associate members, as well as ECA members. And so, yes, I don't know. I don't think so that ESCAP provides a similar alternative, but maybe it's worth contacting them to see if they might provide some support on CRVS research. There was another question from, yes, I'm going through the chat, Anne de la Torre, who was asking about how CART participants are supported with conducting literature reviews. So we don't really open, some repository or library for our participants. Unfortunately, we don't have access to that. We do however, have a lot of resources that we can direct them to. So, for example, some of these repositories or libraries are available for different low or middle income countries, and so we've been directing our participants through that. And also, thankfully, a lot of CRVS research is typically published in open access journals. And so we try to promote more open access resources as possible to our participants, but we have been able to give them access to some articles whenever they needed the articles for the research. And so, yes, I think we've been managing things differently based on if the participants had access to it or not based on their current work setup. And then there was another question from Hasnana Ranguti about if CART also allowed participants from non-government offices. And yes, at least on the ESCAP side, we had a few participants from civil society organizations. So definitely we're very much we're welcoming any participant who is interested in researching CRVS or has CRVS as part of their daily work. So yes, we're also interested in research coming from practitioners working in civil society organizations. If anyone else has some questions, you can also raise your hand and unmute yourself and simply ask. Again, I'm sure you all have a lot of questions regarding our participants' topics. So maybe people don't have questions right now, but I'm sure, especially if you're interested as a prospective applicant, you might get some questions later on. And so thankfully we do have some information. We have a lot of information on the Get in the Picture website about this initiative. So there are these are the links for the CART webpage with information about this initiative in general, some of the projects that we were supporting, and the eligibility requirements for any prospective applicants. And there's also the application form that is in this webpage. Be mindful that applications for our next cohorts or our third cohort of the CART is open until the 9th of November. So, please look into applying if you're interested as soon as possible. If you have any questions about this initiative or CRVS research in general, we also have CRVS research email that we share with ECA and ESCAP, so crvs-research@un.org. And then secondly, also, if you're already on our website or if you're interested in CRVS research, but maybe not particularly in this initiative, we do have the 2026 CRVS Research Forum, which is happening in early 2026. Yes, please go on our website and see some of the information about these events. And so, yes, thank you so much, everyone, for joining this Asia Pacific Stats Café that we're doing in collaboration with ECA. And just before we end the session, I do have another announcement to make. So next week, especially if you're interested in CRVS or research, we're doing a pretty interesting Stats Café session on the role of resilience in CRVS systems, where we'll have a senior researcher from Swiss TPH come and present her work on resilience frameworks, as well as a lot of country examples that were done in a UNICEF research, and then learn a bit more about practical implementation of these frameworks with the Civil Register of New Zealand. So it's happening next week on Tuesday. So more information is available on the Stats Café website. Again, any questions about the CART or our CRVS research activities, please contact us at crvs-research@un.org. And yeah, before closing the session, I'd like to thank all of you for joining, and especially to Gabishika, Stephen, Lichi, and Liako for coming over, waking up early in some cases, and presenting your topic to us. I think it's really insightful to see how you've progressed throughout the training, and it's great to see that most of you are at the final stage of your dissemination process, and I'm very excited to see some of the outputs or more outputs from the work that you've been doing. So yeah, thank you for sharing about your topic and about your experiences as participants. And on that note, thank you for joining this session of the Asia Pacific Stats Café, and we hope to see you next week for our session on CRVS and resilience.